Hi, I'm Liz Bailey and I'm a clinical psychologist working with Manchester's virtual mental health team for our children with disabilities. This training video is for residential childcare workers caring for children on the autistic spectrum. The aim of the video is to help you understand how these children might experience and perceive the world, and hopefully this will help in your caregiving role. Accompanying the video is a handout set and also an activity at the end, which we hope that you will do individually and then as a team together. We're going to start the training by focusing on what is autism. I'm going to play a brief animation by the National Autistic Society called Amazing Things Happen, done by Alexander Amelines.
We are all different, and that's wonderful. Some differences are easy to see. Height, hairstyle, gender, eye color, and so on. Other differences can't be seen. Our favorite foods, fears, or special skills. Interestingly, the way we see the world is also different. For instance, what do you see in this drawing? Most people see a duck, but some of you might have seen a rabbit. Whichever you saw, you are correct. This is just a trick drawing to show you that all brains work differently. The brain is your body's computer. It works differently for all of us and controls how you learn. That's why we are all good at different things. How you feel, which is why we all feel different emotions. And how you communicate. Sometimes the brain is connected in such a way it affects the senses and how we perceive and read situations and interactions. This is known as autism. Many people have autism, so it's likely you already know someone who is autistic. And for this reason, it's useful to know a little bit about autism. The special wiring inside an autistic brain can sometimes make the person good at tasks we may find difficult, such as mathematics, drawing, or music. It can also do the opposite, and activities we find too easy are incredibly difficult to them, such as making friends. The senses constantly send information to your brain about your surroundings and other people. However, when a person's brain and its senses don't communicate well, the brain can become overwhelmed and confused, affecting how they see the world. Picture yourself walking down the street. This is how an autistic brain may experience the same way. Scary, isn't it? Sadly, in many cases, the person can't say out loud how they feel. So even though there's chaos going on in their heads, they seem okay on the outside, unable to ask for help. We all develop behaviors to help us feel calm in uncomfortable situations. We may look away, hug ourselves, chew our fingernails, fidget, bite our lips, and so on. Equally, autistic people develop behaviors that help them cope with these intense moments. These actions may seem unusual, but they're just their way to feel calm. When they happen, it means they are having a hard time. The kind thing to do is not to give them an even harder time by getting cross, ignoring them, or mocking them. People with autism need friends who are willing to take the time to know them. With good communication and plenty of patience, everyone would be better off. People with autism are not ill or broken. They simply have a unique view of the world. And with a little support from their friends, they might just be able to share that view with us. Autism can make amazing things happen.
I hope you enjoyed watching that animation, and I'm sure it resonated with some of the children that you care for. One of the points made was that behaviour that is displayed by challenging behaviour often makes sense to them, but it can also be seen as challenging behaviour by other people. So it's important to try and understand the function of the behaviour. There are 4 main functions of behaviour. Firstly, it is to escape or avoid. Secondly, it may be to gain something you want. Thirdly, it may be to obtain social interaction or attention. And fourthly, it may be to induce stimulation, to reduce boredom, or for enjoyment. Our task as adults and carers is to try to understand the function behind this behaviour and the function it serves, and to support children and young people to meet their needs in a more positive way. It's very important that a whole team approach is adopted for this, and that consistency is ensured in terms of everyone who's caring for the child in their network. We're now going to look at behaviour through an autism lens, and there are 8 prompts to help us remember how a young person with autism might experience the world. Firstly, social interactions can be challenging for me. Children may have difficulties in reciprocal interaction, so they struggle to understand and enact the give and take of how people get on. It may be that they don't understand unwritten social rules. So, for example, the social rules around personal space or topics of conversation. Thirdly, they may lack interest in other children. They can appear quite solitary and in their own world. Or it may be that they wish to make friends, but they do not know how to do this effectively. Challenging behaviour can occur when social interactions are a trigger for stress and anxiety, or when the behaviour enables the person to escape a social interaction that they're finding really intolerable. The second prompt, I may need support to communicate and to understand other people's communication. Children may well have difficulties both in showing and understanding expressions, body postures, and gestures, so they may not be able to communicate their feelings and also understand other people's communication. Children with autism have a literal understanding of language, so they may struggle to understand sayings or jokes or complex language. They may be very concrete in their understanding and not get the meaning that you intend. It may also be that these children have a very good vocabulary, but use of their language to communicate socially or functionally can be limited. Challenging behaviour can occur when the individual does not understand a situation or the communication in that situation, or the individual does not have a more effective way to communicate their needs. Thirdly, I can't tell what other people may be thinking or feeling. Children with autism have difficulties in understanding how other people are thinking and feeling. They appear to have what's called mind blindness, and they lack theory of mind. So they lack the ability to put themselves in someone else's shoes and think that other people can think differently about a situation to them. They may struggle to predict what other people are going to do, and this can cause them to feel quite anxious, or it may mean that they lack an interest in the social world. Children with autism also tend to lack empathy because they can't imagine what it's like to be them or to feel that way. They struggle to put themselves in someone else's shoes. And finally, children with autism may have a reduced desire to please others because they can't understand the pleasure that they can give other people. It can be seen that children with autism, therefore, might struggle to interact with other people, and their behaviour might be seen as challenging because they're not able to understand what another person is thinking. The fourth prompt, I may have routines I need to stick to or behaviours I need to do over and over again. I have special interests that are very important to me. Children with autism can appear very rigid about routines or the ways that things can be done. They struggle if change is made or that they cannot do their routine in the normal way. Most children with autism develop repetitive behaviours, and these can range from movements to ways of playing or to routines. and most children have special interests or preoccupations that might be unusual in their intensity or topic. Challenging behaviour can occur when these routines are threatened and when the person cannot access activities that reduce their stress or provide stimulation. It is important to remember that these routines or behaviours are very important to the child. The fifth prompt, I need additional support to manage change. The social world can appear very unpredictable for children with autism. Changes often raise their anxiety or trigger their challenging behaviour because they are feeling threatened or unsafe. Children with autism usually need additional preparation for changes, and this can include seemingly small changes, for example, moving from one lesson to the next at school, or if a staff member has slightly changed shifts and may be on half an hour later. It's important to communicate to the child in a visual way so that this is helpful for them and they don't feel anxious. Challenging behaviour can occur as a response to change or as an adaptive way of trying to keep things the same. Sixthly, I may have different sensory experiences to you. Children with autism are often over or undersensitive to noise, touch, sight, taste, smell, and pain. And this was mentioned in the animation in terms of how children with autism experience the world. It may be that aspects of the classroom, their school uniform and clothing, or aspects of their home environment cause them significant problems. It's important to have a sensory assessment to try and understand the levels of sensory need for each child. Challenging behaviour can occur as a response to sensory overload or in order to increase or change sensory experiences. I'm now going to play an autism sensory overload simulation. It's important to keep the volume loud for this, as is recommended at the start, because this will help you experience the situation more realistically. The seventh autism prompt, I may be really good at seeing detail, but I don't always see the bigger picture. Children with autism often have strengths in spotting detail or understanding systems. However, they may miss the bigger picture. It may be that they can't put all the small pieces of information together to make a coherent whole. This can also be seen if a child is giving information or recounting an event. They may give lots and lots of very small detail, but fail to give the coherent narrative. Challenging behaviour can occur when the person is unable to understand a situation and they're not able to grasp what is expected of them because they can't see the bigger picture. The final prompt, I am a child first with my own story and my own likes and dislikes. It is important to remember that every child with autism is different. It's also important to develop knowledge about the individual child to try and understand further how they see and experience the world and also whether they have sensory needs. It is also important to bear in mind the child's developmental stage, their family situation, their personality, any adverse early experiences, and also the current environmental situation. One size does not fit all. Finally, we're going to do an activity. As a staff team, I'd like you to think about the young person with autism who you are caring for. Go through each of the 8 lenses and reflect on how each of these is relevant for your young person. If you do this individually to begin with, and then share your experiences and thoughts as a team. This will enable you to have a more holistic view of understanding the child that you are caring for and will hopefully help in terms of your caregiving role. Thank you for watching this training presentation. If you wish to discuss it further or to think about the child that you are caring for, please do not hesitate to contact me. My telephone number and email address are on this final slide. Thank you.